Hi, my name is Dorothy Drew. I'm a hypnotist in London, Ontario, and I've been doing it for a few years. And I work often with people with cancer. And I've had my own health issues in the last few years, and one of them has been high blood pressure. And I've been on medication for it, and my blood pressure's still been creeping up. And then the doctor wanted me to put on a second medicine, and I started thinking, if I can help people with cancer, why can't I do something about my own blood pressure? And then so that's what I've been exploring in the past little bit. And then, there's a lot of anecdotal evidence. I've talked to a few other people on some of the Facebook groups, and one-offs really wouldn't convince any kind of medical doctor. And of course, during hypnosis, during a session, during that release, one would expect blood pressure to go down significantly. But then the question is, will it stay down? Will the person still be okay a week later, a month later, 2 months later? And I did a lot of literature searching, and there doesn't seem to be any consistent kind of research about it. And so anyway, I thought it would be really interesting to be able to get some clients who have blood pressure, because that's not something you can fake. You either have high blood pressure or you don't. So can we take some clients, and I don't know even what would be statistical or anything like that, enough to maybe convince medical researchers to investigate this in a formal basis. So maybe 10 people, 15 people, 20 people. It would still be anecdotal because it wouldn't be formal, but it would still be a really good way of maybe helping our own clients, even if we can't talk about doctors accepting it. So I did a search of PubMed and didn't find very much. One very recent article, and I'll put, great title, Close Your Eyes and Relax. And the focus of this paper was actually more on anxiety and blood pressure being a side effect, because people who are anxious often have high blood pressure. And so they sort of talk about it in passing. It's very interesting that way, but it is in passing. But another kind of very interesting project was done a number of years ago, and uh, I don't think I can do a screen share easily, but there was a book called The Upside of Stress. It's a great book to read. And what it was saying is, like, stress has been given a bad rap by Hans Selye, and stress is an important part of life, but it's the reaction to stress. I mean, this is a synopsis of a really, a very involved, wonderful book. But one of the projects they looked at, they did a project at a hotel, and they worked with the house cleaners, and they were looking at their blood pressure as one of the aspects. It's a very strenuous job. It uses a lot of work, but even so, a lot of these women had high blood pressure, or they had sugar problems, or they had weight problems. So they took sort of half the group and just told them, these are some healthy ideas, and left them at that. They took the other half of the group and really taught them that the work you're doing every single day is healthy and beneficial, and just the health you're doing will help you to lose weight because you're being active. And that group really did lose weight, and they did lose body fat, and they had better blood pressure, but there was no change in the control group. So it's not like a real study, but just the power of the mind was able to do that. And that's what we work with as hypnosis, the power of the mind. So what I'm going to propose, if people can get clients who have high blood pressure, or I mean, refer them to me, and work on them with two two aspects and possibly three. So one aspect is to have somebody do a walking self-meditation type of thing. And so I'll describe that. And then that would be like they're walking and then emptying their mind. And even if they do that for 5 minutes, and I mean, I live in Ontario right now, walking on the sidewalk is not safe. So even if it was just to be in a chair and do this motion of doing left, right, to move the hands, move the legs, and empty the mind, just for a few minutes, it seems to have a role in helping to reset the body. And the other aspect would be to create a script, because I've been taught that having this recording that person listens to for at least 21 days and preferably 28 days helps to reset the mind. That's the way I was taught to use hypnosis, and it's worked fantastic for my clients. So I was going to create a script that would be very much focused on relaxing, letting the body go, letting the tension go, letting the blood flow easily, those kinds of visualizations, and then creating maybe a 15-minute script that they could listen to at night. And if they would commit to listening to it every day for, say, 28 days. So they would do this 5-minute walk twice a day. They would listen to this recording at least once a day, preferably at night. And if they wanted an option, but I'm not going to push this one, is they would have a personal session. Why do they themselves have high blood pressure? I recently had a session for me. It was very interesting, and I think it was very helpful, and it did reduce my blood pressure a little bit overall. And it dealt with some tough things I had in my past. But I guess I can't get my mind around the idea that trauma from the past directly affects blood pressure, because I never had high blood pressure until about a year and a half ago after I had COVID. And after I had COVID, all kinds of things in my body seemed to fall apart. So, so, uh, so I find it very hard to wrap my head around the idea that the pressure the horrible things that happened to me in the past could really be affecting my blood pressure now. But of course, having a hypnotherapy session, letting go of pain, that definitely will have effect on the body. It definitely will improve the body. But I really think that this focused hypnosis for releasing blood pressure that I'm currently doing, and then the walking, I really think that will make a difference. But I mean, I'm just one person. And I'm sort of like a biased person, because I am a believer in hypnosis and hypnotherapy and releasing. So it would be interesting if people can expand it. So I thought if we had, you know, 10 people, 20 people, even preferably more, if we could have 20 people, and I can't do all that. So that's why I'm reaching out to other people to do a project to take someone with high blood pressure, work with them, and have them keep some records. Keep if they don't have a personal high blood pressure monitor, if they just go to the local drugstore, the local Shoppers Drug Mart sort of thing, and um, and just measure their blood pressure maybe once a week, even just to see. Although I think most people who are on blood pressure medication will have a personal thing, maybe measure it every day at noon hour and say, what's my blood pressure now? And that could start to document whether the hypnosis can make a difference. So anyway, that's the proposal, and I will make the recordings I've made. I'll make them available to anyone who would like to try this, and try to get friends, relatives with high blood pressure to do this kind of project for. I'm hoping 4 weeks would be enough for data, but at least it would be a way to maybe get a real researcher to get involved. Um, and so if you have questions, please reach out to me. If you want to work with this, I'll have the recording. You can use the recordings with my voice. I'll make the script available if you want to make the recording with your own voice. And then whether you have the actual the personal session with somebody is between you and the client, but if you get them to at least do the generic recording and this walking self self hypnosis, probably better to say self meditation, uh, and just keep a record and see what the data is. And if we can prove that, okay, we did this with 20 people and 15 of them lowered their blood pressure and were able to talk to their physician and get off medication. I mean, that could be exciting. That could be mind-blowing. That could be world-changing. Anyway, I'm sort of interested in doing this, and I'm hoping maybe some other people would be interested in working with me and just getting at their clients and working with getting some data. Anyway, if you are interested, please reach out and I'll make the scripts and everything I'm doing and the recordings I'm doing. I'll make them available. Anyway, thank you for your attention and your time. And let's see. It's recording.